Look at your fingernails right now. Go ahead, hold your hand up and look at them closely. Because what you see on those nails could be the difference between catching a deadly heart problem in time and finding out about it on a hospital bed. Your fingernails are not just dead tissue sitting at the end of your fingers. They are living windows into the most critical systems inside your body. And your heart, when it is struggling, when it is failing silently before you feel a single chest pain, before you have a single shortness of breath that stops you in your tracks. Your heart sends its distress signals to your fingernails first. 7 of them. 7 silent warning signs that your heart is in danger. And right now, most people looking at their hands have no idea what they are seeing. Every single year, millions of people die from heart disease that was preventable. Not because the warning signs were not there. They were there. Weeks, months, sometimes years before the heart attack or the heart failure happened. But because nobody recognized them. Because nobody was looking at the right places. Doctors look at your blood pressure and your cholesterol. They run an EKG. They check your heart rate. But when was the last time your doctor picked up your hand, looked carefully at each fingernail, and told you what they saw? Almost never. And yet the nails tell a story that the blood tests and the EKG sometimes miss entirely. I am Dr. Calara, and welcome to Health Hub. Today I am sharing the 7 silent warning signs your fingernails show before your heart fails. I will explain exactly what each sign looks like, what is happening inside your cardiovascular system when it appears, and what you must do the moment you see it. Please do not skip any part of this video because sign number 5 is the one that most people see and completely misunderstand, and it could be the most urgent signal your heart ever sends you. Subscribe right now if you have not already, because this is the kind of information that does not appear in most health conversations, and you deserve to know it. Before we go through the 7 signs, I want you to understand why the fingernails reveal heart problems at all, because the biology behind it is both fascinating and deeply important. Your fingernails grow from the nail matrix, the tissue at the base of the nail beneath the skin. That matrix is one of the most vascularly sensitive tissues in the entire body, meaning it depends enormously on consistent, high-quality blood supply to function properly and to produce healthy nail tissue. The capillaries that feed the nail matrix are tiny and delicate, and they are among the first structures in the body to be affected when the heart begins to struggle with its job of pumping blood efficiently. When cardiac output falls, when the heart is pumping less blood than the body needs, the body responds with a series of compensatory mechanisms designed to protect the most vital organs. The brain, the heart itself, and the kidneys get priority. Blood is shunted away from the periphery, from the hands, the feet, the skin. The nail matrix, sitting at the very end of the fingers, is among the first tissues to experience reduced blood flow. Changes in oxygen delivery, changes in the pressure and quality of blood reaching the nail bed, changes in the levels of certain proteins and compounds in the blood, all of these show up in the appearance and texture of the nails before they produce symptoms the person can consciously feel. This is the biological reason why examining the fingernails has been part of medical physical examination for centuries. Long before we had EKGs and echocardiograms and troponin blood tests, physicians used the hands and the nails to assess cardiovascular status. We have become so focused on technology that we have nearly lost this art. Today, I am giving it back to you so you can use it on yourself and the people you love. The first warning sign is clubbing of the fingernails. This is one of the most significant and well-documented nail changes in all of medicine, and it deserves careful attention. Clubbing describes a change in the shape of the fingertip and nail, where the tip of the finger becomes enlarged and rounded, and the nail curves downward over the tip of the finger, like the back of a spoon facing downward. The nail loses its normal flat or gently curved profile and becomes convex, bulging outward. The angle between the nail and the skin at the base of the nail, which is normally less than 180 degrees, becomes greater than 180 degrees in clubbing. This is called Shamroth sign, and doctors use it as a diagnostic test. Clubbing develops over months to years through a process that is still not completely understood, but is believed to involve chronic low oxygen levels in the blood and the accumulation of growth factors and platelet-derived compounds in the fingertip capillaries. When the heart is not pumping efficiently, or when heart disease has led to abnormal mixing of oxygenated and deoxygenated blood, as happens in congenital heart defects, the tissues of the fingertip are chronically deprived of adequate oxygen. The body responds by trying to grow more capillaries and more tissue in that area, producing the characteristic swelling and rounding of the fingertip. Clubbing is associated with several types of serious heart disease, including congenital cyanotic heart disease, infective endocarditis, which is an infection of the heart valves, and chronic heart failure. It is also associated with serious lung disease and some other conditions, which is why any observed clubbing must be evaluated by a physician immediately. You can perform a simple self-check. Place the fingernails of the same fingers on both hands together, back to back, with the nails facing each other. Normally, you will see a small, diamond-shaped gap at the base of the nails. If that gap is absent and the nails press flatly together, this is a positive Shamroth sign, and it warrants urgent medical evaluation. The second warning sign is a blue or purple discoloration of the nail beds, a condition called cyanosis. The nail beds of a healthy person with good circulation should be a consistent pink color, reflecting the oxygenated blood flowing through the capillaries just beneath the thin nail tissue. When that blood is poorly oxygenated, whether because the heart is not pumping effectively or because there is an abnormality in how blood flows through the heart or lungs, the hemoglobin in the blood carries less oxygen and takes on a darker bluish-red color. This shows through the translucent nail bed as a blue or purple tint. Central cyanosis, where the bluish discoloration reflects a systemic problem with oxygenation, is a medical emergency. It means that the oxygen saturation of the blood is significantly reduced, which can happen in acute heart failure, in severe heart valve disease, in pulmonary embolism, where a blood clot blocks the arteries to the lungs, and in congenital heart defects. If you look at your nail beds or the nail beds of someone you love, and they appear blue or purple rather than pink, do not wait to see if it resolves. Call emergency services or go to the emergency room immediately. This is one of the most urgent signs in all of medicine. Peripheral cyanosis, which is a bluish discoloration only in the extremities, including the nail beds, while the core of the body maintains normal color, is less immediately critical, but still requires urgent evaluation. It indicates that blood flow to the periphery is severely compromised, which can occur in heart failure, in shock, and in severe peripheral artery disease. Either form of cyanosis at the nail beds is a signal that demands immediate professional attention. There is no acceptable version of blue nail beds that should be watched and waited on at home. The third warning sign is splinter hemorrhages. These are tiny dark red or brown lines that run vertically beneath the nail, parallel to the sides of the nail, looking remarkably like small splinters trapped under the nail surface, hence the name. They are in fact small bleeds from the capillaries within the nail bed. In most cases, splinter hemorrhages result from minor trauma to the nail and are not concerning. But when they appear without any history of trauma, particularly when multiple nails are affected, they can be a sign of infective endocarditis. Infective endocarditis is a serious bacterial infection of the inner lining of the heart, particularly the heart valves. The infection creates small clusters of bacteria and inflammatory material called vegetations on the valve surfaces. Pieces of these vegetations can break off and travel through the bloodstream, where they lodge in the tiny capillaries of the nail bed and cause the small bleeds that appear as splinter hemorrhages. Because the nail bed capillaries are so small and so numerous, they act almost like a filter that catches these circulating emboli and makes them visible. Infective endocarditis is a life-threatening condition that requires urgent antibiotic treatment and sometimes emergency heart surgery. It can destroy heart valves within days to weeks if untreated. The splinter hemorrhages are one of the few external visible signs that can appear early in the course of the infection. Other associated signs include fever, fatigue, and joint pain. But sometimes the splinter hemorrhages appear before these more obvious symptoms become severe. If you notice multiple dark vertical lines under your nails that you cannot explain by any trauma, and particularly if you have any fever or feel generally unwell, seek immediate medical attention and mention the nail findings explicitly. The fourth warning sign is pale or white nail beds. Where cyanosis turns the nail beds blue from lack of oxygen, pale or whitened nail beds indicate reduced blood flow and potentially anemia. Severe anemia, a deficiency of red blood cells or hemoglobin, reduces the oxygen-carrying capacity of the blood and forces the heart to work harder to compensate. In people with pre-existing heart disease, severe anemia can precipitate heart failure or worsen existing cardiac dysfunction because the heart simply cannot sustain the increased workload indefinitely. Pale nail beds can also indicate shock, a condition where blood pressure drops severely and blood flow to the periphery is drastically reduced. Cardiogenic shock, where the heart is so weakened that it cannot maintain adequate blood pressure, is one of the most serious medical emergencies in existence, with a very high mortality rate if not treated immediately. In this context, extremely pale or white nail beds, accompanied by cold and clammy skin, confusion, rapid weak pulse, and feeling faint, are signs that require an immediate emergency response. A specific pattern called Terry's nails, where most of the nail appears white with only a narrow pink band at the tip, has been associated with congestive heart failure, as well as liver cirrhosis and other serious systemic conditions. The fifth warning sign is nail pitting, which is small, pinpoint depressions or pits in the surface of the nail plate. Most people who notice these small dents in their nails assume it is from minor damage or from some cosmetic issue. Many people have seen nail pitting their whole lives and never questioned it. But nail pitting, particularly when it appears on multiple nails and in significant numbers, can be associated with conditions that have cardiovascular implications. Psoriasis, which causes nail pitting as one of its features, is now recognized as a condition associated with significantly elevated cardiovascular risk. People with psoriasis have higher rates of heart attack, stroke, and heart failure than the general population. And the degree of systemic inflammation that causes psoriasis also damages blood vessels throughout the body. Nail pitting is also associated with alopecia areata and with certain connective tissue diseases that can affect the heart directly. The point here is not that nail pitting by itself is a cardiac emergency. The point is that nail pitting, particularly when it is new or has become more pronounced, should be evaluated by a physician. And that evaluation should include an assessment of cardiovascular risk factors, because the underlying conditions that cause nail pitting often carry with them a significantly elevated risk of cardiovascular disease that deserves attention and management. The sixth warning sign is horizontal white lines across the nail, known as Merkes lines. These are paired white horizontal bands that run parallel to the lunula, the white crescent at the base of the nail. Unlike vertical lines, which move with the nail as it grows, Merkes lines do not move as the nail grows because they reflect changes in the nail bed tissue beneath the nail rather than in the nail plate itself. When you press on the nail and compress the underlying tissue, Mierke's lines temporarily disappear, which helps distinguish them from other types of nail changes. Mierke's lines are a sign of hypoalbuminemia, which means abnormally low levels of albumin in the blood. Albumin is the primary protein produced by the liver, and it plays a critical role in maintaining the oncotic pressure that keeps fluid inside the blood vessels, rather than leaking out into the surrounding tissues. When albumin falls significantly, fluid leaks out of the vessels and causes edema, swelling, particularly in the legs and abdomen. Low albumin levels occur in conditions that affect the liver, the kidneys, and, critically, in severe chronic heart failure. When the heart fails chronically, the resulting congestion and reduced blood flow to the liver and intestines impairs albumin production and absorption, causing albumin levels to fall. The appearance of Mierke's lines can therefore be a visible sign of chronic heart failure, severe enough to affect protein metabolism. The seventh warning sign is koilonychia, which is the medical term for spoon-shaped nails. Instead of the normal, gentle, convex curve of a healthy nail, the nails in koilonychia become flat or concave, curving upward at the edges, so that the nail looks like a small spoon that could hold a drop of water. You can test for this by placing a drop of water on the surface of the nail. If the nail is spooned, the water will sit on the nail without rolling off. In a normal nail, it will roll to the edge. Koilonychia is most classically associated with severe iron deficiency anemia, and severe anemia, as I described in the context of pale nail beds, places significant additional strain on the heart. But koilonychia also occurs in hemochromatosis, which is a condition of iron overload, and in certain cardiovascular risk conditions including Raynaud's disease, where the blood vessels of the fingers spasm in response to cold or stress, severely reducing blood flow to the nail matrix over time. Any newly developed spoon-shaped nails in an adult deserve prompt medical evaluation with attention to both blood counts and cardiovascular status. Now I want to talk about what you should do with everything I have just shared with you. The first thing to do right now, today, is to sit down in good lighting and examine your own nails carefully. Look at every finger on both hands. Check the color of the nail beds. Look for any vertical or horizontal lines. Check the shape of the nail and the fingertip. Look for any pitting or surface irregularities. Use the tests I described: the diamond gap test for clubbing, the water droplet test for spooning. If anything looks different from what I described as normal, write down specifically what you see and which nails are affected. The second step is to make an appointment with your doctor and bring your observations with you. Do not simply mention in passing that your nails look a bit funny. Describe specifically what you have noticed, on which fingers, and for how long. Show your doctor your nails directly. Ask explicitly whether the nail findings could be related to cardiovascular health. Ask for a cardiac risk assessment that includes not just cholesterol and blood pressure, but a thorough clinical examination. If you have any of the more urgent signs I described, particularly blue nail beds, sudden appearance of multiple splinter hemorrhages, or significant clubbing, do not wait for a scheduled appointment. Seek evaluation the same day. Protecting your heart health goes far beyond monitoring your nails, but the nails are a window that is always available to you, that requires no equipment, no laboratory, no appointment, and no expense. They give you information that can motivate action at a time when that action is still genuinely effective. The years before heart failure, before the heart attack, before the emergency, are the years when lifestyle changes and medical management make the greatest possible difference. Controlling blood pressure, managing blood sugar, maintaining healthy weight, avoiding smoking, staying physically active, managing stress, eating a heart-protective diet rich in vegetables, healthy fats, lean proteins, and low in processed foods and excessive sodium. All of these interventions work best and matter most when they begin before the damage is irreversible. Your heart has been working for you every second of every day since before you were born. It has never taken a break. It has never asked you for anything in return. But it does send you signals when it needs help. And now you know 7 of those signals that appear on your fingernails. Do not ignore them. Do not dismiss them as cosmetic. Do not tell yourself you will look into it later. Your heart deserves the same loyalty it has shown you. Look at your nails. Know what you are seeing. Act on what you find. Because the heart that catches its own warning signs in time is the heart that keeps beating for decades more. Please share this video with everyone you care about, with your parents, your siblings, your friends, anyone who has heart disease in their family, or who simply has a heart, which is all of us. The information in this video is the kind of thing that gets shared, and then suddenly someone sees something on their nail and goes to the doctor and finds something that was caught just in time. That person could be someone you love. Subscribe to Dr. Calara Health Hub right now and leave a comment below telling me which of the 7 signs you had never heard of before. I am Dr. Calara, and I will see you in the next video. Take care of your health because no one else will do it for you.